Alone, I have two beautiful guests, of course, the Black Cyclist for Africa, or well known as Ben Haggai, and of course, a recreational cyclist, Cordero. Thank you for joining us tonight in studio. How are you guys?
I'm pretty well. Excited to be here, and thanks for having us.
Of course, just a brief introduction before we're going to be taking a short break and then we come back to the interview, but just a brief introduction. Why do you call yourself the Black Cyclist?
A good one. So when I went for my first ride in 2023, when I was trying to know my route and everything, whenever I called guys to help me with the route map into 9 countries, they kept on saying, hey, you are the first black person we are getting to see cycle a bicycle across different countries. And that's how they kept on saying, hey, you seem to be a black cyclist for Africa. Then that's how I acquired that particular name. And so that's how I kept it that way. Yeah, so it's just a way of identifying, and people just trying to say, hey, the very few blacks that we see are moving around with bicycle. And so being an opportunity to see you, it gives us an acknowledgement that other people can actually doing within the continent.
Of course, thank you so much. Jemima Cordero, thank you for coming on the show. You are a recreational cyclist. Just to, of course, give my viewers a brief introduction of what that is and why you decided to venture in it.
Thank you so much. I'm a recreational cyclist. I just ride for fun, and for exercise, and being able to just have to know other people, get to understand myself, and also just for the mental purpose, to just relax and be better.
Of course. Yeah. I'm having the Black Cyclist for Africa. This man has cycled through 13 African countries with a bicycle. That is quite impressive. Of course, what really inspired you to start cycling on a bicycle, Ben?
Thank you so much. So what inspired me was as I grew up, I've always been an active person. So in 2018, I had a leg surgery, and then I was told by the doctor, hey, you know what, you can't keep pounding. And so that's how I found a segue into cycling. And now cycling is part of wellness to me and part of fitness. And so that one gives me the opportunity to be on the saddle or on the bicycle. Every other day I commute to work using a bicycle. I can't remember the last time I used, for example, a matatu. So it's become a way of life. And so that one allows me to feel I'm physically enjoying healthy living by just cycling to work. And since I started it when I was little till now, just being active, then it's just a nice segue that I keep doing it. Now, my transition into cycling for other things, I'm passionate about public health, and that's how there's the relationship between my cycling and picking on public health topics. So the first year I went for the longest ride, which was across 9 countries. It was basically, I turned 40, and I told myself, why not challenge myself? And for the 40 people who are 40 years, they're able to do something. And so that's how I started off that particular journey of trying to create awareness towards wellness. You can do it at whatever age, just try and do something actively. Of course, now relating it to the bicycle, I was asking myself, is it safe to actually even use a bicycle to cycle across other countries within East and Southern Africa? And so when I went through this particular journey, the answer is yes, it is safe. I came safe. However, there are opportunities where we could be able to support our different cyclists across the different countries to be able to champion for safe roads, areas where we can have easy roads for cyclists to use and so on, because that will pave way for, as my fellow panelists would say, recreational. So I don't fear. You know, for me, I have no any other way of doing exercise. That's my way of life. But for others, they want to join in just to enjoy, see views, enjoy the city in a different way, go outside the city and feel safe is the most important part.
Yeah, of course, Jemima, have you cycled across Africa in your recreation? And are you looking forward to cycling across Africa?
Oh, wow.
How many counties have you cycled across in Kenya?
No, I think the longest ride I've cycled is 100 kilometers.
100 kilometers?
Yes.
But it's still for, of course, is it for his same course or just recreational?
Recreational.
Recreational.
Yes.
Ben, You've cycled across the 47 counties, if I'm not wrong, 46 counties
Correct.
of this country in Kenya. How has that been for you? And of course, how do people take this? Do people like, you know, is this just a bicycle? But people are aware. Do you go telling people that of course, I'm riding this bicycle, of course, for road safety this time. And of course, you're about to take on 13 Southern African countries to raise awareness for that Turner illness.
Correct.
So do you go across Kenyan counties telling people like I'm riding for road safety zone? And what is the reception?
Thank you so much. Looking at a bicycle, just a bicycle, most people will take it like it's for just people who want to move from point A to point D. That's about it. But what I'm trying to look at is my passion for public health and to create awareness towards things or issues that surround public health is what I'm pretty much advocating for. So in 2023, I pretty much did road safety and wellness. In 2024, when I went through 46 counties, Mandera was the one that I was not able to reach. It was December, and again, the headquarters, the county headquarters will be off for their Christmas holiday. So that's how I never went there. But on the road, I was championing for Baby Briella, who basically had a liver challenge and was in India. So they had a deficit of a medical bill. And so I said, why not rally into this particular initiative and cycle, try to raise funds for Baby Briella. And so there's a whole team behind me who say, hey, you know what, it's a good cause to always give back to the community. And having worked in the development space, I say, hey, as a parent, it's very hard to raise certain amount of money. And when the kid was born and all these challenges, also the family had gone through a lot. I said, I'll use my two-wheel to be able to do this. And there's been an amazing support from Kenyans. And they really overwhelmingly gave me the heart for continuity. So a bicycle to me is not only a tool, but it's what we normally call in sports. It's a tool for sports development. So I'm using it for social purpose, so that any health challenges, we can be able to rally for it using a bicycle, which now I keep on using information in my social media platform and sharing, and people get to know. Well, they see me riding, but there's a message to it. And that has always been part and parcel of what I pretty much champion.
And of course, you coming here, of course, you're about to ride, cycle across, now this is not riding, cycle across 13 South African countries, and you are doing it to raise awareness about the Turner syndrome. I want you to briefly explain what is this syndrome, and of course, what drew you to this specific course.
Thank you so much. Turner syndrome simply is a condition where it affects only the girl child and the women. And what that means is basically they're meant to be born having what we call 46 chromosomes. So they end up having 45 or partially a half or something. So that one affects the developmental growth and other physical features, hormonal, and that one makes it a challenge for them to be able to either get good health medical care, quick to advance what you call medical attention from when they're born all the way as they grow, like the congenital aspects of when they're born. Those pose as challenge. So one could be born by by heart defect. And so without an early intervention, then it's very hard to know that that person is a Turner. And so when they pass through that process, they begin seeing more challenges, but they're not able to know what really am I suffering from or what's my condition. So how did I link up with the Turners? The biggest question here was cycling being at the core of it. We met with Jemima, and she was like, hey, you know what, Ben? I heard her talking about the condition and saying, hey, you know what? It's very limited. It has very limited information across Africa. So I said, let me Google about it. And when I Googled for sure, there was only like one research done in Botswana. And then we had two organizations, one in South Africa and another one in Kenya, the Turner Trust. And so those were the only part that was informing us about Turner syndrome. But the question is, that makes it a rare disease. But how do we create awareness towards people being able to understand that, hey, this is an issue that someone can be able to support at the caregiver level, at the facility level, and equally at the community level. And so I'm coming in to be able to raise awareness that, hey, as much as it's a rare disease, according to the WHO, we here in Kenya want to create a platform where people can be able to not only talk about it, but be able to share it to other people. That's number one. And number two, allowing Turner syndrome not to be let on the periphery. We want it to become to the front floor. For example, the same way I'll say autism. Now people are like, oh, I know autism. That's the same thing we want to do for Turners. Why Africa and cycle across all those countries? It's because I want to imagine my desktop research about Turners with the limitation of information. Going out will allow me to be able to say, can I find people who are doing the same work with Turners across the countries? And if the answer is yes, to what extent are they doing it? And how can we share those information so that raising an awareness comes with facts? And those facts is exactly what I'll be trying to get across board to move it forward. Tomorrow I'll be engaging, and it will be like a meet and greet, and I mean pretty much like a flag off. I'll be meeting a couple of Turners who will flag me off. They'll share, hey Ben, you know what, as you're going out, keep in mind that we want you to ask certain questions. We want you to be observant about a certain aspect. Are our challenge similar to maybe if you do find other Turners outside there or researchers who are doing the same? And how can there be opportunities for collaboration or resource? You bring resources together so that they're able to meaningfully support other people who might not necessarily be in Kenya, but outside. So basically that is why I'm doing this. It's for a cause that it's deep in my heart to be able to share. Anytime you hear Black Cyclist for Africa and you go into it, you're like, oh, it's road safety. Oh, it was Baby Briella. Oh, it's Turner. That by itself creates a notion that there's more information besides just cycling, but there's opportunity in sports to use sports for development.
For development,
yes.
Yeah. And you see now you're using sports for development. For someone at home who may be wondering, does this cause pay, or this is just off, like this is just you? You are doing it for someone, but does this pay? Because you know most people engage in this sporting activity, football, rugby, name it, basketball, at least to earn a living. Speak to someone maybe in the slums, in the village, where they want to also cycle, like you've cycled in Africa with your bicycle. First of all, safety concern. How do you manage to cycle across Africa alone?
It's a valid point, and it doesn't pay. But if you look at the reason behind why I picked this course is to it's pretty much the bigger picture. It's beyond me. I'm not looking at myself, Ben, hey, you're going to gain in this process. Mine is, if I leave this particular space, will somebody remember that the cycling led to Turner syndrome being part of WHO Awareness Day? That would be a tick to me. The same thing. As I go now as a cyclist, I want to pretty much be very categorical that there's a lot of concern regarding safety. So I work with other cyclists from other countries. So that is the first thing, like, hey, how is the route from this point to that point? I would like to cover certain areas. Then some from news and media, just to pick ideas, hey, there's a political situation in a certain country, it might not be pretty much safe. So I'll be like, hey, do I reconsider passing through that particular area or use another route? There's the element of nature, animals. Yeah, we might want to coexist, but the reality sometimes they're wild. So how do I take care of myself is pretty much the same thing. Talking to local communities, they might say, hey, you know what, passing this place after 7 is okay, a.m., but if you get at 6 p.m., just stop where you are. So I use a lot of information from the communities as they continue cycling along, and most people who support me are equally doing research, like, hey, Ben, there's a cyclist who is on your X account who is saying, hey, you know what, you better use this other route because probably there might be some road that is being constructed or something is happening, it might delay you. So pretty much, yes, I do consider that one as a big thing. And anybody at home can join the ride. You might just want to ride for the purpose of recreation. You're most welcome. There are so many people will be joining me. They might not right now understand what is Turner syndrome. But as we cycle together, those will be the conversation that we'll be talking about together during the road. Of
course, let us also take a listen to Jemima Kodero. Of course, is a communication specialist and a Turner advocate, and of course, a recreational rider. You've not been able to ride through Africa, or you've not even been able to achieve the milestone that he has achieved, but at least you ride for recreational purposes. Yes. Just give us a little background of you in this cycling, and the message that you might have to any young girls out there who also want to ride, to cycle.
Thank you so much. Through the recreational cycling, I met Ben, and meeting Ben means that is how you create your network. I, being a Turner, I advocate for the Turner syndrome to be known, to be able to be acknowledged, because you see, Turner syndrome, there is one in every 2,000 girls, there is one. So I want to imagine how many girls are having Turners, and yet they are not known. Now, through sports, this is a better way whereby we can be able to create awareness about Turner syndrome. Now, Turner syndrome have challenges, like not just having a normal life, because we are born with different, missing a chromosome. So missing a chromosome means that your life may not be as straight as others, but it doesn't mean that you not do sports, because sports is the one that makes you a better person. Now, being in the cycling space and cycling, it makes a little bit feel relaxed, see that, oh, I can even tell more people about Turners while I am cycling. So as Ben has shared, as he was traveling, I was like, why not share about Turners so that you can be able to know other Turners? Are they sporty people, or are they just relaxed? What are they up to, and how can we get to be known? And especially across Africa, there is very limited data. And even when you come back home in Kenya, is there a Turner who's doing any kind of sport? It's not known. Is there any data about Turners in anywhere? It is not. But you see, now today I have come to represent them, to say that also as we can cycle, we can run, we can be able to do, and we can be able to live life as a normal person. And now it's a journey, because you see, the first thing is creating awareness, because how many people know about Turner syndrome? It is very, very rare. So the first step is let people be able to know. Then also us, we can be able to say we join into the sports, and also being acknowledged, not being different, but being able to say that you can also do it. Missing a chromosome doesn't mean that you're missing, yes, because you'll find that we are born with different challenges that it make us maybe sit back, relax, and say, no, we are not going to do it. So as why I call myself a recreational cyclist is because I may not be able to take the more than 100 kilometers, 200 kilometers, because one of the conditions that Turners are born with is heart defects. So I have had several surgeries that I cannot be strong enough. So that's the reason why I can be able to say someone else can be able to represent. But you see, the more we know about the condition, it means that many people can be able to go to many sports, and also even doctors will be able to know, oh, this is how we can help you. You can be able to be better, because also as we have dreams and vision of becoming sport people.
Thank you so much, Jemima, and I'm very happy that I've hosted you on this show, so that every other Turner person that is at home, perhaps they don't know what to do, they're just sitting in the house, they can learn from you, and they can even join you guys in cycling and other sports. It doesn't have to just be cycling alone, but right now at least you're here because of cycling. Yeah, thank you so much. And of course, if we come back to you for raising awareness for this Turner syndrome and road safety as well. You've cycled for road safety. Now you are going to cycle 13 countries, South African countries, for Turner syndrome. What has been your most challenging ride?
My most challenging ride that I'll always say is going through a place called Chirundu to Vutsi in Zimbabwe. And what made that one to be most challenging is because I went through an 82-kilometer stretch into a national park, and Zimbabwe did away with poaching and anybody living within the parks. So it's just animals, trees, and so on. However, the beautiful thing about the national park, it stretches through a plateau, then rises into an escarpment. Now, in my backpacking, I carry a lot of load. So that one by itself, by the time I was getting towards the 50 kilometer, I was so drained. And it made me realize, why am I doing this? If there was another cyclist who was to journey through this, how else will I advise them to be able to go through that? So physically, it was quite draining. And I kept on telling people, that's the point I felt like, hey, at 62 kilometers, if there was a helicopter could just come and pick me from there, it would have been the best thing. But the reality was, it's a park, very few vehicles. A truck stops, then I say, hey, could you help me to get to the next place where there are at least people? The gentleman tells you, you know what, in the cabin we have a camera. And so I can't really help you. So I told myself, you know what, why did I actually start this journey? Is to know how these roads are and to appreciate it as a cyclist. So I gave myself an acknowledgement that, hey, let me keep going on. So I went into a softer gear and kept going through the escarpment. When I saw a community, houses, I felt like life has come to a new space. Reason being that sometimes going for these cycling challenges, to do things that are beyond myself, is to also acknowledge that any step that I'm doing it, I'm helping other people to have an information and a beautiful information that could help them either take the same journey, do it differently, or remember the story and remember why we are doing it. I'm doing it for Tana. So as I'm struggling and remembering there's a Tana who is struggling more than myself, and most likely even from the infant stage. And myself who is healthy, why not keep soldiering and seeing myself through this? So that is basically the biggest thing, is the weight that I'm carrying and being able to get into these places where sometimes there's no much activities, but one has to go through them to appreciate the nature and topologies of the different countries and ways where I'm passing through.
And of course, as we wrap up this show, what will success look like for you? Are you looking to raise a certain amount? Are you looking to break a certain record? Or are you looking to just finish strong?
Thank you so much. Pretty much everything. But what will, and I guess Jemima will equally just want to rope into this or jump into this. If I go on a computer and Google Turner syndrome after embark, and it comes with a lot of information, I'll be so happy within Africa. Reason, currently under the sit and research, there's not much information. So this particular session that you have offered us adds the value towards the conversation, using sports for development, sports for communication, and that one adds the momentum towards talking about health communication and being somebody who champions for public health, then this one becomes a plus. So the answer is yes. For me, success will look like, when I left, there was very little about information on Turners. When I'm back, I just Google and I see a lot of things popping up, people searching. That would be a plus for us. And so that one means, do we already have enough resource to start the conversation? It could be towards gearing Turners to advocate for certain aspects. Like, for example, in the current situation, our SHA, is there an opportunity for that? The insurance giving them the best that they're able to get? So that is exactly the big picture where most likely the Turners will be looking at. But for me, that awareness is the biggest thing. Coming back, getting people knowing about it, Ule Benua Turner syndrome, that's about it. That will have ticked all my, or rather checked all my boxes.
Well, thank you so much. I was having Ben Haggai, or popularly known as the Black Cyclist for Africa, is a man who has cycled through 13 African countries. He's also on a mission right now to cycle through other 13 South African countries to raise funds for Turner awareness. That is where we wrap it up.